Hey everyone, how's your NCLEX review going? Today we will be talking about Myxedema Coma, okay? So, again, I do want to apologize if you do hear noise and tinkering in the background. That's my lovely infant daughter playing. So, again, we're going to be talking about Myxedema Coma. As we all know, it's basically a loss of brain function, right? Usually as a result of severe hypothyroidism or an untreated hypothyroidism, right? Again, I do apologize the background noise, and it is considered a life-threatening complication. Okay, and what are the signs and symptoms in our patient? Usually, what we see is a depressed respirations, and usually these are significantly depressed respirations. Therefore, our PaCO2 or the partial pressure of carbon dioxide in the arterial blood would actually be increased to compromise the decrease of respiration, right? And obviously the normal, as we all know, the normal PaCO2 is between 35 and 45 millimeters of mercury. Okay, you need to know your values. That's very important. Also, what we would notice is a decrease in cardiac output. So it's actually not an increase, but a decrease. I don't know why I have an increase here, but it would be a decrease in cardiac output with our patient, right? And it would be a severe cerebral hypoxia, right, which is a decrease in oxygenation within the tissues. So, what are the main nursing interventions that we need to do? Basically, we need to maintain our airway. Uh, we need to have IV fluid replacement to our patient. We also do need to provide continuous EKG monitoring with our patient. Okay. Now, in regards with pharmacology, we we're going to be giving thyroid. I'm sorry again, guys, for the background noise. We will be giving thyroid hormone therapy, right? And the main NCLEX drug for hypothyroidism and myxedema coma is levothyroxine, right, or Synthroid. Now, also remember there are a few things that you do have to know while giving Synthroid. We do have to take note that the client is at risk for cardiac complications if the metabolic rate is increased too quickly, right? Therefore, we do have to monitor the cardiac system, right? So, uh, since the patient could be cardiovascularly compromised, right? And the symptoms for that are palpitations, shortness of breath, chest pains, and also tachycardia and or rapid heart rate. Okay, so again, I'm just making this short and straight to the point. Talk about tracheotomy, right, which is the sterile surgical incision into the trachea. And usually the main purpose for this is to establish airway in our patient. And this is usually used for a long-term, usually mechanical ventilation for the patient, okay? Now, we can talk about tracheostomy. Now, tracheostomy, on the other hand, is the stoma or the opening that results from the tracheotomy. And what this does is it allows the insertion and the maintenance of the cannula, right? Now, usually a double lumen tracheostomy tube has three parts, okay? The three major parts. It's the outer cannula, the inner cannula, and the obturator. Now, the outer cannula is just the one that fits into the stoma and keeps the airway open, okay? So that's really all it is. And the inner cannula basically helps locks the outer cannula into place, okay? And the obturator basically helps and allows the outer cannula insertion. Now, the main thing that you have to know with the obturator is that with the obturator, it is removed immediately after the outer cannula insertion, and it's always kept with the client at the bedside, okay, in case of what we call an accidental decannulation, or if the cannula falls off, okay? So this has to be in the patient's bedside. Now, our patient is at risk for aspiration, okay? Now, swallowing is actually possible with tracheostomy, with a tracheostomy tube in place. However, there's what we call a laryngeal elevation, right? And it's affected, and therefore we do need to assess the patient's risk, right? The patient is going to be risk for aspiration. Therefore, prior to any intake, whether it's medication or food, we do have to assess the client for aspiration. Okay. Lastly, inability to produce sound. Okay, so what's going on is that the airflow in and out of a tracheostomy usually would bypass the vocal cords, right? And Obviously, that would result in the inability to produce sound or speech. So that's basically it. The airflow in the tracheotomy bypasses the vocal cords. Okay. Now, again, guys, I just want to keep this short and straight to the point so you really know the most important major points, such as the obturator, right? That is very important to have it at the client's bedside. Is that you might encounter in your NCLEX exam, which is that of hepatitis. And hepatitis is basically inflammation of the liver tissue. It's plain as simple as that. And believe it or not, a good portion of the people who has the less severe type of hepatitis will sometimes show no symptoms at all, whereas others can develop some of the more common symptoms such as jaundice, which is basically yellow discoloration of the skin. And what occurs is that the liver is not able to break down basically or get rid of the bilirubin, which is a yellow pigment that is formed when our bodies break down the red blood cells in the body. Okay, in the liver actually. Now, other common symptoms includes poor appetite, vomiting, tiredness, lethargy basically, abdominal pain, and diarrhea. Now, as we all know, hepatitis can be temporary, or what we call acute, or it can be long-term, which is chronic, depending on whether it lasts for less than or more than 6 months. Okay, now acute hepatitis can sometimes resolve on its own, or it can progress to a chronic hepatitis. But the thing is, if it's not treated, it can eventually lead to acute liver failure. And what happens over time is that chronic form can progress to a scarring of the liver, right? Or can even cause, like I said, liver failure or liver cancer too. Now, let's talk about classifications of hepatitis and the way of transmission. Now, there are actually 5 types of hepatitis. There's A, B, C, D, and E. And this is a quick review, so we're just going to go over basically the first three hepatitis, which is A, B, and C. Now, let's start with hepatitis A. The incubation period usually can last from 15 to 45 days, and it can be transmitted primarily through fecal and oral route. So prevention basically includes sanitation and hand washing, okay? And there is a vaccine available for hepatitis A. Now, with hepatitis B, it's transmitted through blood-to-blood contact, also sexual contact, and drug use. So being in contact with needles and razors. Now, there is also a vaccine that is available for hepatitis B. Okay, now lastly, we will look at the most serious one actually, which is hepatitis C. And hepatitis C is transmitted again through blood-to-blood contact and also sexual contact and drug use. Now, take note that the patient can be asymptomatic with a person with hepatitis C, and some are only diagnosed once abnormality is being detected within the liver enzymes. Now, symptoms of acute hepatitis C includes fever, fatigue, loss of appetite, nausea and vomiting, abdominal pain, and jaundice, okay, which is the yellow discoloration. Now, here are a few of the things that you want to keep in mind for your NCLEX exam. Now, with hepatitis B and hepatitis C, it is connected with cirrhosis and liver cancer, okay? Now, also, what we call enzyme-linked immunosorbent assay, or what we call ELISA test, is the initial screening test for these clients suspected of being infected with hepatitis C, HCV virus. Now, liver biopsy can also be used to confirm the diagnosis of hepatitis, okay? And the treatment most often used for a patient with hepatitis C is a combination of two medicines, interferon and ribavirin, okay? Again, this is a quick and short review, so this is it for now. Good luck on your NCLEX exam, and thank you so much. God bless. Thank you.